Welcome, everyone, to this episode of Freedom Hub's Free Market Cash Patient. I'm your host, Jeff Cantor, along with my co-host, Charles Froman. We're definitely part of the Freedom Hub, which is the Disruptors Intersection. We're connecting activists and entrepreneurs, disrupting everything for a better world for sure. And we feature everything. It revolves around the main website, your-mp.com. So we'll detour to there in a minute. But in the meantime, we do want to let you know, if you didn't realize, that there's an issue with healthcare in America. And, our goal here is to make some sausage and figure out how to bypass whatever name you want to place on that entity in the middle, because we got to get the patients back to the doctors and vice versa, and understanding costs, because without the idea of costs, it's difficult. Also, we have to get to more accurate information because there's a ton of it out there, and everyone's got their vested interest in steering you one way or the other. You need to figure it out, and this is an area for us to help bring that to the light. Just as a little sidebar, we do have another show we do earlier in the day, and this one's more a broad-based, freedom-oriented program. You'll certainly want to check it out, and here's a list of some of the archival links. But rather than worry about that, you'll come to the main site, which we'll look at in a second. But then also, if you're interested in the solution that we've discovered, you're going to want to tap into this last link here, patientempowerment.mpb.health, and we'll take a look at that for a second. So first off, let me show you that site, and we'll come back to it. But this is the area you'll learn all about what we're going to find out about tonight, and this will be very advantageous for you to be cognizant of. But anyway, if we go to the main site, yourmp.com, or I should say your-mp.com, you'll see there's a variety of drop-downs, some great stuff to look at. And under the home tab is where we house the webinars. And then the more important aspect of it is continuing the conversation. Because after you learn about the topic or the person, you may want to help support them or get involved. So you'll click on that, continuing the conversation. And here you'll see a way to tap into every speaker of the past. And it goes on quite a bit. And there's some really fantastic people. A lot of important topics. So frankly, you're going to need to get involved with a variety of these people. Under the Freedom tab, we've got those that are out fighting for our freedom in general, for health reasons and others. Here are some issues to be aware of. These are things you would want to click on and sign up and act on. They're very important, the bulk of them. And then also here are a variety of different organizations trying to solicit and maintain the freedoms we've got. And on that note, let's kind of get into today. So if you come back down here to the webinars tab, it'll take you to this page. And here you're going to see the breakout on who's on the two shows. I'll come back to that in a second, a little breakout on who's coming up next, in the future weeks. And then very importantly, here's the video links to the videos from the past. So this one will be posted by the weekend. And here you can come back here and go through a variety of them. We've been doing one every Wednesday for years, so we haven't missed a week. And you'll see there's a wealth of opportunity of topics and people to get engaged with. And from that, you'll then go to continuing the conversation and participate with that person. So with that thought in mind, let's find out what we've got in store for us today. And here's where I'm going to let Charles jump in and take the reins.
Gladly, Jeff and Wendy, welcome. Like Jeff said, for I think, Jeff, now almost 3 years, we'll have to look at the actual start date of our weekly Wednesday webinars. We've been hosting thought leaders in healthcare, liberty, markets. That's what we're about, empowering people to live and flourish. And tonight is especially cool because we have the top salesperson from the company that brings revenue to you and me, Jeff, so that we can host these weekly events and help organizations and efforts and be part of the solution. And it's really fun. And I think people will agree when your work is fun because it really fits your path, your goal as a human, why we're here. And I really mean that. The health plan that we sell and that we'll be featuring tonight is so empowering for patients. And if anyone really is into policy, they know that healthcare, kind of like education, is really a top-down mess. It's kind of a cartel. It's controlled by special interests in a vigorous way. It's very hard for new companies to offer better solutions because of all the red tape and controls from DC and the state governments. And I was a health staffer in Congress back in the early 90s, and we learned about health savings accounts way back then from various scholars, including John Goodman, who a few years ago at Forbes featured our company, how we combine health savings accounts, which help you save up for out of pocket, with a new payment method called sharing, as opposed to insurance, which really is a retread of good old fashioned mutual aid. And it was so exciting to break into this market as a salesman because I had been an advocate and a lobbyist for so many years and decades. So it's been a thrill to be part of this commercial venture, getting featured in Forbes, linking up with other entrepreneurs who are on this call who have liked us and the part we play in creating cash patients, which opens the market for other reforms that the providers want to bring, offering cash-based innovations. There's just so much good from a disruptive company like ours that helps families, helps small business, but also helps the market itself. And Wendy is our leading salesperson. She's very popular with her members. And so, Jeff, I'm excited to hear tonight's presentation.
Fantastic. So am I. So Wendy, on that note, I'm going to give you control here. So
fantastic. And I just want to kind of add to what Charles was saying about it's always awesome to work in the world that you're passionate about. I would have told you I'd never have anything to do with health care, health insurance, any of that. I'm not a big fan of health insurance, but when our organization stumbled upon the solution and created the solution that we have now, I can't tell you how awesome and exciting it is for me to be part of the solution rather than to be pulling out my hair every year, with the new insurance solution. So this is a non-insurance solution, healthcare, not health insurance that we're offering. Basically, the solution is actually a combination of multiple different companies and components, giving members the best possible whole solution. It's giving members a lot more freedom, control, flexibility of their healthcare choices, that of which has been kind of declining every year with how things have been going in the traditional world. So what we offer is actually good for employers, employees, and individuals, small businesses. It can truly help differentiate an organization, from their competitors. One of the biggest, financial challenges for small businesses is the health line item. Some people can't afford to offer it at all. Some people do, and it's not awesome. Employees often are terrified to leave a large organization for fear of going off on their own, because of the cost of healthcare. So with this solution, it can truly help differentiate, small business organizations. It helps people attract solid talent, and it helps them keep that talent as well. So next. So basically, like I said, the membership is comprised of multiple different companies and components. The base of the membership gives all members access to telehealth, access to virtual healthcare. Basically, members will have an app on their phone. They'll be able to text, phone, or video chat with a doctor 24/7, 365. Through that app on their phone, they can access primary care doctors, behavioral health specialists, women's healthcare doctors, and pediatricians. Members can truly communicate with those doctors as often as they need, as long as they need. Those doctors can prescribe medications for a lot of things. If a member has a chronic ongoing health issue, that chronic health issue will be tracked. So if that member, reaches out to a different doctor at a different time, they do not need to repeat themselves. That will all be logged, and the new doctor will be up to speed and can help that member, moving forward. So, and unlike most other, telemedicine options, members can actually reach a doctor typically in less than 60 seconds. So it's truly, an amazing way to get nearly instant access to a doctor, especially in everyone's busy life, and especially, during times of COVID and such, when people don't necessarily want to be out and about if they're not feeling well. So that is the base of the membership. And then the next part is the what we call medical cost sharing. And that's a concept that has been around for 25 plus years, but it's truly members helping members. It's stripping everything back down to the basics. Again, giving members a lot more freedom, control, and flexibility in their healthcare choices, like I said prior. Basically, there are 3 different levels that people can choose from. I'm going to describe the most common, kind of best value for the money, and that's what's called the $1,000 initial unshared amount level. So what that means is, if and when a member gets sick, they're going to pay the first $1,000 of a medical incident. The community of members will share 100% of the remaining cost above that point for all eligible medical expenses. There is no cap on that. So for a more real life example, say someone's diagnosed with something new like cancer. That patient, that member, again, will pay that first $1,000 of that cancer incident. The community of members will share 100% of the remaining cost above that point. So unlike traditional options, it truly includes all costs associated with that cancer. So all of the doctor visits, specialist visits, chemotherapy, radiation, physical therapy, x-rays, labs, medications, you name it. All of those things are lumped into that one cancer incident that member pays for one time only. So again, unlike what we're used to, say that cancer needs to be treated into a second or third year, the member does not have to pay that $1,000 again now that it's suddenly a new year. It's still part of that same one incident. It will only be considered a new incident again if and when that cancer has been, free and clear of all treatment, symptoms, diagnosis, everything for at least 12 months. And then most people ask, kind of worst case scenario, what their financial risk is. So for a household, the worst case scenario is they're responsible for a maximum of 3 separate incidences or medical needs per year per household. So that could mean 1,000 times 3, $3,000. If that family manages to have 3 separate, medical incidences within that family within that year. Hopefully that makes sense. And then another important differentiation, actually beyond, a lot of people ask, what happens if they have a 4th, 5th, 6th scenario? In that case, if and when the cost exceeds $500 for that initial incident, they will actually waive the entire cost of that additional medical incident, meaning that member pays nothing for that 4th scenario. If, however, it's kind of a one and done, something small, $150 doctor visit, they don't want to deal with the paperwork, the member will pay for that on their own. Okay, and then the biggest difference between, actually, let me go to the next screen. Actually, let me go back. I'll just jump around. Biggest difference between this and traditional options is there is a pre-existing conditions clause. So what that means is anything that's been symptomatic, diagnosed, and or treated within the last 24 months, costs associated with whatever that is, will be the member's responsibility to pay for 100% year 1. Year 2, the member would pay, call it that $1,000 initial unshared amount, and then the community members would share up to a max of $25,000. Year 3, the member pays their $1,000, the community will share up to $50,000. Years 4 and beyond, the community will share up to $125,000 for that pre-existing condition. Again, if it's something new, like the cancer incident I described, then there is no cap on it. It's a new incident, and the cost will be shared 100% above that chosen IUA. Let me go back. Here's just a nice example of how the costs break out in more of a real life example. This is a member with a heart attack taken to the ER. The member spends 5 days in the hospital and receives EKG, surgery, post-surgery physical therapy, medications, etc. So you could see the total cost of that bill. It was $77,250, and the member paid their $1,000. So as you can see, it's fantastic value for the member. Let me go back again. So the next component of the membership gives members access, depending on the membership someone chooses, gives access to the members through a true insurance component, gives them access to all of the Affordable Care Act compliant annual wellness visits. So that's mammograms, pap screenings, colonoscopies, immunizations, some basic blood work, whatever people are used to through their traditional insurance is the same, because it's all dictated by the Affordable Care Act laws. So for that part of the membership, because it's insurance, it's actually the only time that a member needs to be concerned with a doctor network. That doctor network is one of the largest networks in the country. And also the other added value of the insurance component is the fact that it gives members access to fund a health savings account. So for those of you who aren't familiar with that, it gives basically members the ability to fund a health savings account, meaning pre-tax dollars. For an individual, they can fund it up to $3,600, and for a household up to $7,200 in 2021. And that money in that account can be used for medical, dental, vision, hearing, chiropractor, all that good stuff. If you don't use the money in the account, not a big deal. That money rolls into, or remains in your savings account. It's your savings account. No one else can touch that money. It rolls into the next year. If someone hits, when they hit retirement age, they will be able to use that money, or they could roll it into a retirement account or continue to leave it there for true medical expenses. That's that. And then another incredible benefit with this membership is all members are given access to life care. Basically, it's an employee member assistance program. It's giving members access to resources for truly all of life's challenges. It is so incredibly comprehensive that I couldn't even begin to tell you all of the tools and resources that are within the life care membership. But to just kind of highlight a few items, members have access, to truly a live person 24/7, 365. Gives people tools for work-life balance, gives people tools for hundreds of legal documents, rentals, leases, gives people access to elder care assistance, housing assistance, et cetera, et cetera. The list goes on. The kind of most impactful part of this membership is it also gives members access to a maximum of 12 mental health counseling sessions per member per year. How that works is they're given access to 4 sessions. If and when the member uses those 4 sessions, there's a 2-month waiting period, then they'll have access to 4 more. If they use those 4, there's another 2-month wait, and then they have access to 4 more. So again, 12 per member per year. In the state of California, for whatever reason, they have some limitations, and that's capped at 6. Keep that in mind. Then, because everything that I just described is a little bit unique and different, all members are going to have access to a concierge team, and that concierge team will truly hold the hand of the members. They are going to provide a ongoing support at all times for the member. So when members, if members forget, what's included in the membership or how to use it, et cetera, the concierge team is there to support them at all times. And then to get into a little bit of the utilization, I already talked about the wellness component of the membership. That is a true insurance component. Therefore, members will have an insurance card to present, and they must stay in the doctor network. That is the only time members will actually present a card and need to be concerned about a doctor network. For all other accidents, injuries, illnesses, when someone needs to go to the doctor, if it's beyond the scope of the telemedicine, then those members go in as a self-pay patient and tell them that they do not have health insurance. This is not health insurance, and they want the best cash price. The reason for that, the many reasons for that, but the number one reason for that is it gives that patient generally anywhere from a 10 to 80% discount straight off the top of the retail rates, literally. Once people start using this and experiencing it, it truly empowers them, and it's very, very eye-opening. And I can tell you that from my own experience. A lot of people get nervous, what if I land in the ER? I don't have 10 grand to fork over, for an ER visit. No worries. In that case, you're going to do the same thing. You're going to tell them you're a self-pay patient. You want the cash price. You're responsible to pay that $1,000 as a deposit and then have them bill you for the rest. As soon as you have that bill, basically you call the concierge. And again, they're going to hold your hand. As soon as they're going to talk you through uploading the bills and the supporting documents into the system. Once the medical cost sharing company has those bills, they actually become your advocate, and they're going to go to work on your behalf, negotiating those rates down as well as possible. Once they reach an agreement with the doctor or hospital, they actually pay that hospital or doctor directly, again, on behalf of that member. So the member pays that first $1,000, and then the medical cost sharing community shares 100% of the remaining cost above that point. So the member is not, at risk for needing to fork over a large sum of money straight off. Hopefully that makes sense to people. And then this is kind of the most common membership available. This is built for individual, entrepreneurs and small businesses. So anyone that is self-employed, 1099 contract workers, or a small business, they qualify for this membership. And you can see the prices are quite extraordinary for everything that I just described. For an individual member, only at the $1,000 initial unshared amount, the cost is $275 a month. Member and spouse, $500 a month total. Member and child, $499 a month total. And for member and family, $685 a month total. There is a $125 admin setup fee year one, and then a $25 annual renewal fee years 2 and beyond. As you can see, there are higher IUA choices. My opinion, they don't make nearly as much financial sense, but of course everyone has their choice in the matter and can choose whatever works for them. So Jeff and Charles, that's kind of the basic overview, and I'm happy to answer questions that anybody has.
Okay, very good. Well, that was quite good. Let me ask you a question pertinent to, if you want to capture your camera there again, pertinent to the pricing. If I'm a small business owner and I've got, like, say, 6 employees, am I able to do something with this, or is that only for the individual person? How does that part work?
That's a great question. So, yep, for start my video. Does that work? Okay. Yep. So basically, for the secure membership that I just showed you, that allows as small as a group of 1. So it could be 1 individual self-employed person that qualifies to use that membership.
And then also address this, since, other than the ACA stuff where I'm just going for the mammogram, and kind of that fixed stuff where I have broke my leg or I have some other issues or whatever it might be, I have the latitude to really kind of go anywhere. within my city, across my state, across other state lines, as it were, what kind of doctors can I see? Do I only have to go to ones that work at like the Cleveland Clinic, or can I go to see chiropractors or naturopaths, or how does that work?
So that's a fantastic question. Again, the only time you have to worry about the doctor network is for the annual wellness visit, the ACA compliant wellness visits. For everything else, you truly do have freedom. This is open to alternative type medicines. That being said, they do want you to get any alternative type doctors pre-approved. They have to be licensed in their specific area of expertise. And ideally, with the alternative medicine, they'd like it to be less costly, less invasive, less timely. Are some of the qualifications that will enable help that member get that approval for something
Excellent.
alternative.
Very good. Excellent. Well, let's open it up for some outside questions. So everybody that's inclined, please raise your hand. And in the meantime, I see that Charles's hand is up.
It is, Jeff and Wendy. Great presentation. I like those new slides. What about partner organizations promoting empowering benefits options to their members, like chambers of commerce or member associations? Has that been something that has worked with the company in the past?
Absolutely. That's a fantastic partnership for our company. We work with real estate groups, chambers, any types of organizations that, a lot of people out there that are self-employed, desperately need help and need to know about these other options.
Super. Dr. Campbell, I see your hand up.
Yeah. Hi, Bob Campbell from Pennsylvania. I'm wondering, I've been becoming a real student of this cash model. When you make a pitch to an employer, do you ever get people who say, okay, now what's the hitch? What do you exclude? What's the catch? Because you can't have those kinds of prices and give me the kind of health care that I have now with, my Blue Cross or whatever. What do you say to that? And do you ever hear that?
Yep. Yeah. I mean, most of the time, kind of with the spiel that I just gave, it eliminates a lot of those questions, but absolutely. I mean, there are, number one, the pre-existing conditions clause eliminates some people. It's not perfect for everyone. There is a tobacco limitation for anyone 50 and older. They cap the sharing for heart attack, stroke, I think COPD, and one other thing I'm forgetting at the moment. They cap the sharing up to $50,000. So it's actually a great risk for someone that's a tobacco user. So not a good option for them. Also, the fact that people are going in as a self-pay patient, reducing the cost, again, anywhere between 10 to 80%. I think the average that I just read was about 62% cost reduction by being a self-pay patient. That right there helps keep those monthly costs down significantly. So there are many number of reasons why they're able to keep the prices at a reasonable rate.
Can I ask you how long you've been in operations? How many covered lives do you have? And how often do you have expenditures exceed your incoming share amount? So,
great question. Yep. So the medical cost sharing company, so all the, there's, like I said, multiple different companies and components in the membership, all of who've been around for varying degrees of time. You're probably most concerned about the medical cost sharing component. They've been around for a number of years now. Their membership has grown rapidly. I do not have current numbers on their membership. The last one I think was maybe around the first of the year, around 25,000. So that should be significantly higher at this point. And then about their financial kind of stability. So they have many number of kind of backup plans put into place. So a portion of the monthly cost goes to admin fees, somewhere between 8 and 10%. Another small portion goes to kind of a rainy day backup fund for the case that you're talking about. And then the rest goes, into a fund for true medical expenses. So what what they've done for a backup plan, as a self-pay patient, most members, if for, say for example, that ER scenario, someone had a $10,000 bill, most people aren't going to be able to pay that overnight. So they're going to set up an ongoing payment plan with that hospital or doctor. Could be over the course of months or years, most likely years. So with how this works, if the medical cost sharing company did not have sufficient funds, then what they would do is pay, say, 80% of those medical costs, kind of spread around the whole membership, and then pay the next 20% over the course of the next few months. They've actually never had to use the backup plan. And even say the next few months, they're still not caught up. Then at that point, they would put it out to the membership and say, hey, we need to raise your rates by, whatever amount, you can stay or go, but this is what we have to do. Again, they have not had to do that. Even during the pandemic, they have not had any financial problems and needed to tap into any of those backup solutions.
One thing to add to what you just said there, in instances with these variety, and there's some of these organizations been around 30 years, as it were, but whenever they've had to raise their monthly share amounts, they don't go up like insurance does, where it jumps up like some enormous crazy figure. It would go from like 275 to like 292. It's very minimal because, again, 100% of the increase is what was the extent of the medical bills. The admin didn't go up. All the rest of those overheads didn't change. So they're very an honorable way to pay these medical bills for sure.
Yeah,
George, go ahead.
Sorry, it's also stripping everything back down to the basics, kind of how it should be, getting all the middlemen out of the picture and finding the true cost of services now with this.
Yes, exactly. George, I see your hand up.
Yes, I kicked in a bit late. My son had another little granddaughter here about 2.5 hours ago, so we've been busy.
Congratulations, very good.
Yeah,
thanks for making it tonight under the circumstances.
Well, everything's working out fine. I'm working with some people that are doing an alternative education program. It's kind of NOAA-based, faith-based. It includes. It's already ramping up. They've already got a building. They've already got some facilities. They're talking about teachers escaping the politicized public school system. They're done with it. They're looking for alternatives. A lot of them are fairly senior teachers, and I'm wondering if this would be an optimum program to send to the. I know the CEO who's managing this.
Absolutely, it would be fantastic. I mean, again, it gives people the freedom to choose again, and it probably couldn't be a better option for people like that.
One of the nice things, real quick, one of the nice things about it too is that you get to kind of do what in one company, if I buy like Blue Cross, everyone's stuck with it. With this, I can have this for everybody at the company, but everybody goes and uses it where they wish. So it really lets them choose their own flavor, which is really exciting. What else were you going to say, George?
Yeah, I know your video or your summary, your podcast comes out a couple days after this, and you wouldn't have any objections with me taking that and sending it to this person, right?
Oh no, I would encourage you to send it to everyone you know.
Okay.
So don't be shy with any of our videos.
All right.
But
Thank you very much.
A lot of this is not educational too, because somebody might hear about this and be a senior. Well, it's not for them, but they have grandkids.
Right.
So everyone needs to learn about what these options exist in America. It's not getting much news, and it's a shame because the doctors love it because it gives them the latitude. Early on when I got involved, one of the doctors said, hey, look, if I let my patients have this, does this mean that I get to be the doctor again? And they loved it. And hearing Dr. Campbell shaking his head, yes. So there you go. I mean, it's just totally accurate. Paul, I see your hand is up.
Great, thank you. It's nice to be here. So one of the things that I've noticed, so I have this large network of doctors. Wendy, I have UberDoc. UberDoc has direct pay doctors from around the country. We're direct pay specialists. We include internal medicine, all the way to neurosurgery, to everything, to every specialty. And we have doctors now coverage in every state. We have telemedicine as well. And they all are signing on to offer appointment slots for direct pay patients. One of the things that I realized is that, this concept of, and I like to say the DPO, the direct pay option, right, which is what this is, right? You're putting it in lay terms. It's the patient understands that they're truly going in, as you say, a self-pay patient, right? They're going in without insurance, but they're getting a good price. So one of the things that I find particularly exciting is that as UberDoc grows and merges and creates strategic partnerships with more and more, like the DPC doctors and so forth, is that we have that national coverage, and you've got employers now with employees that are working out of state, right? You have people that are remote working. So it's almost like you're never going to control cost. If you think that, you're that Bank of Boston and you're going to have all your care at one of the, you made a deal with one institution, there's no way now with your person living in, Florida or, or California that's working at your bank that's going to be able to have a controlled cost. So I'm wondering that are your plans becoming kind of more attractive for this national option? I just know that from an UberDoc standpoint, your kind of plan is exactly, we're right in your wheelhouse. Our doctors would so much want to work with members in your plan, because that's what our doctors are geared for that, right? And the question is always, what's that next step? And I think that, it's been my mission to convince doctors that direct pay option is viable. It's true. It's a third tier. I call it the 3-tier system, and this is the third tier. And that, but doctors are still kind of reluctant because they don't understand, well, what about the insurance? What about that insurance card? So I'm very interested in being able to offer my network in any way to your kind of your networks, because I think that together we're going to build this direct pay option as a true viable, that people will go out and look for these options.
Absolutely. Yep. It's the perfect kind of marriage of what's happening. And I understand, if those doctors are nervous about it because it's new and different, and, they might think that the members aren't protected, but with the medical cost sharing, with everything that's wrapped into the membership, the members are protected, the doctors get paid quickly and easily. It's truly a win-win for all. We also have a membership that I didn't talk about that is built for those doctors that are DPC, direct primary care doctors. We have pricing adjustments for members, with a DPC membership as well. So, and we have memberships for, I've talked about basically people had to be self-employed, 1099 contract workers, or small business owners. We also have memberships stripped down a little bit more without the insurance component, giving people that are W-2 employees or unemployed or, retired but under the age of 65, they can access that membership. So we truly have memberships for all people in all scenarios.
I think it is definitely the future, and getting more, again, I think part of it is getting the doctors to understand it too. And I feel like that they're getting there. And if you tell me that you get paid immediately or easily without going through what we have to do for insurance to get paid for anything these days, and it's gotten like exceedingly worse after COVID, which you'd think they were sitting on bags of gold, that they would make it different, but they're really not. They're making it more difficult.
Yeah, here's another really cool aspect of the membership that I didn't talk about. So somebody that has, say, a high cost surgery, like a hip surgery, part of the membership will actually pre-negotiate the cost of that surgery. Basically, they'll find the highest quality care at the best price, pre-negotiate it, prepay it in a bundled rate, so that the doctor's getting paid in advance. The member doesn't have to fight with 10 bills after and submitting them and worrying about that once they're trying to heal. It's all truly paid upfront, kind of one and done. It's truly win-win for all involved.
What?
Jeff, did you just?
Jeff's thinking muted.
Oh, I'm sorry. I inadvertently muted myself instead of unmuting myself. I thought I was muted. I was just going to say, in some instances, don't they actually get a reduction in their initial insured amount if they let the organization do kind of what you described?
Yep. So I'll give you just an example. I had a client that had a meniscus knee surgery here locally. I'm in Colorado, and the reference-based price of that meniscus knee surgery is $24,000. It actually got pre-negotiated down to $9,500. The payment was made, in cash over the phone. $9,500 before she went in and had her surgery done. So basically she didn't have to worry about all the bills afterwards. I believe her IUA was $1,000, and because she went through that process, she got that reduced to $500. So she paid $500, and the medical cost sharing community, basically paid, $9,000 as opposed to $24,000. So again, it's truly a win-win for everybody that's involved.
And we're driving the person to actually do the best thing. It's not
Exactly.
we're trying to make you steer as the lesser choice to save money for. No, we're having you do the bundled rate. Everything you described is the best possible thing a person could do, and we're incentivizing them to do what's really the best thing to do. It's really fantastic. Yep. Charles, I see you've got a follow-up question.
I do, a three-parter. Wendy, can you describe list billing, which is a godsend for the smallest employers with a dozen or fewer workers, number one. Number two, and I'll repeat the question if you don't want me to later. With a pre-existing condition phase-in, how would an agent like you integrate, exchanges for those who might need that option while giving the rest of the employees the sharing? And then number three, we all have a mutual friend, Mr. Rod Maxon, on the call. I'd love to have him comment on what he's heard so far after Wendy's finished. Jeff.
Awesome. Okay, so those two questions.
Go for it.
All right. Yeah. List bill. We have list bills set up. Basically, 2 to 49 employees can be put onto a list bill. It's basically an invoice sent to the, main contact of the employer. Those are sent out on a monthly basis. The employer can review the list bill and then pay through credit card or ACH bank draft. Super easy. If there's a self-employed person, individual membership, they pay automatically month to month credit card or ACH bank draft. So that's that part. And then you asked about say an employer group that has say 5 members are on board, but one has pre-existing condition and definitely cannot join, or it wouldn't be in their best interest to join. All the advisors who we work with are insurance licensed as well, so they can help members with the traditional insurance plan to seek out the best option for that person. So we have solutions for all scenarios and all people and all situations.
Rod, well, on that note, welcome. And I'd like to see if you did have some comments here based on Wendy's presentation.
Yeah, I did. Thank you very much. And once again, Wendy, great job. I just want to kind of make an observation, if I might. Many of you know that we're involved in a venture, a joint venture with a primary care, or not primary care, but an organization called Primary Partners Alliance, which is a number of independent doctors in northern Florida around Orlando. They're a ACO, an accountable care organization, which is a little bit different than most of what goes on out there. It's kind of more fee, instead of fee for service, it's more you get bonused, if you will, if you keep your patients healthy. Anyway, my point is that this movement that we've all been involved in for the last 7 years, that it's funny how it's all kind of come together in different phases and how things are happening. And what we're actually doing in that program that's called Our Primary Doc is these doctors are insurance doctors. And this organization is installing a new program in there, a DPC element, that will allow them to service their patients on a subscription basis. Some patients, they're actually becoming hybrid organizations. They're transitioning into that versus what we've seen most of, which is like all in. That's all they do. It's like us against them mentality. And so this is a really unique thing, and I think it's all part of the movement. And what gives me great hope that we do have some solutions here that can go nationwide. Hearing a little bit about Uber Health a few moments ago, and how there's so many movements out there, and Jeff has always talked about the silos, and this program here is first time I've actually listened to the program, and it won't be the last now, because it really is cutting across the whole spectrum, if you will, and you begin to see it actually happening in the big picture. Thanks.
It was great. Fantastic. Well, I got one last question, I think, from Charles, because we're going to wrap it for this evening here.
Well, we have
Jeff,
such a, go ahead,
there's
Wendy.
there's a
Okay.
question from Sam too that I wanted to answer.
Oh, okay. Go for it. Sam, you got your question there?
He typed it in. It says, can a
Oh.
self-employed person who's married and his spouse is carried by her employer for health coverage, can the self-employed person buy a single plan versus a family? So the answer is yes.
The only caveat I said is unless they're W-2.
Well, if they're W-2, they can still join our Care Plus membership, so they have an option.
Right.
Yep.
So there's a way around for everybody. Perfect. Did you have a last question, Charles, in fact?
I did. We have so many great innovators, doctors, and others in the participant list. Dr. Wallen has been a great friend of ours, a cash urologist, involved in so many ventures as a former hospital administrator, trying to really get this cash market going. Dr. Wallen, did you have any comments on what you heard tonight and how you hope the market can change in the right way?
Yeah, thanks, Charles. And Wendy, thanks for the presentation. It's awesome. It's always great to hear about the different evolutions of these sharing programs, how they're all a little bit different and have different options. I guess, MPB, I think, certainly has some significant benefits that others don't, from the standpoint of the concierge and some of the other benefits that you mentioned earlier. So, just learning about that is great. And I think that is, obviously one of the things that I've experienced is that most folks who are in the healthcare industry or in the medical field, they still struggle to get the best care for their family, for themselves, etc. And so, having that concierge for people who are not in the medical field, is certainly invaluable to be able to get them the best, highest quality care that they can possibly get, and to wade through the bureaucracy, that's not just tied to insurance, and it still exists within the corporate hospital systems and etc. So I think that would be the biggest takeaway that I have is just having that, hand holding support to really kind of help people, find the best care that they possibly can is amazing.
Absolutely.
That's one of the very first things that we built into the program, because that became the challenge, as we discovered early on. Everyone loved the idea of going to cost sharing or any of those other type sharing organizations, but the first thing they figured out is they didn't know what to do.
Yep.
When I had Blue Cross, it was killing me on the price, but at least it was really manageable. I had a card, I had a copay, everything was real simple. They had a list of doctors I was allowed to see. So that part made it simple, but the autonomy was great, but they just know how to navigate it, and who has the time to become an expert. So that is a great part of some. I'm glad you spotted that. That's excellent, Dr. Wallen. Well, let me tell you this, Wendy, that was very good. I think we're going to get some new and exciting connections going here today. So I love this when we use this show, and we always make sausage all the time. We think we're interviewing somebody, but we're really creating relationships and activities. So that's been exciting too. So thank you very much for tonight.
Awesome, you bet. One thing I do have one more thing, Jeff.
Please do. Certainly.
I forgot we have an incredible pharmacy benefit program as well.
Oh, you're right. You didn't even mention that. Yes, definitely tell us real quickly. We got another couple of minutes for sure. So definitely excite us again.
Yeah, so through the MPB concierge team, basically a member submits, the list of medications that they have. The concierge team will actually research those medications with 5 or 6 different partners that we have, and give that member access to the most affordable rates possible. I can't tell you, I've never seen a better program. Of all the ones that we've looked at, this is truly the best. And a lot of times the cash price is cheaper than what people are paying for their copay, which is always a big surprise. Even the crazy high cost, brand medications, we're able to get at much more affordable rates. Some of the stuff is sourced, worldwide. Some of it's done through coupons and, discounts through the pharmacy companies. They have mail order, local, whatever. Basically, there's a solution for nearly every drug that people can need.
And again, the nice part is that there's someone to do it for you.
Exactly.
Call the concierge. They do all that legwork, do all that homework, because there's got to be a better price out there, but you haven't got the time. You end up at the local grocery store and you pay whatever the heck it is. So that's good.
Exactly.
So anyways, thanks so much. That was great.
Awesome.